Good afternoon, everyone. Today we are discussing about the hands-on training program for PG diploma. There is no need of thesis presentation. Only the fellowship, masters, and doctorates students is compulsory thesis presentation. This practical assignment part includes various modules, and we are going to discuss here step by step. Our WNHO Institute of Sexuality, run under government recognized startup WNHO Healthcare, Health to Self-Employment Skill Empowerment Program only for qualified doctors and psychologists, which include MBBS, BAMS, BHMS, and so on. WNHO Institute of Sexuality conducting PG diploma, fellowship, masters, and PhD in psychosexual counseling since last 10 years, and so far 400 students are registered for this program. And course coordinator, myself, Dr. Ramesh Maheshwari, is certified sexology educator, the American Board of Sexology. This our startup is government recognized and is registered 2017. The institute is running since last 30 years under the name of WNHO Clinic. The course coordinator, myself, Dr. Ramesh Maheshwari, working at as a senior consultant in sexual medicine at Aditya Birla Memorial Hospital and assistant professor at D.Y. Patil Medical College, Pune. We have the following 4 modules. Basically, each modules we are completed 10 chapters, which includes module 1, values in sexuality, anatomy and physiology, psychology of sexual response cycle, neural mechanism of sex, hormones in sex, sexual problem, history taking, and physical examination and investigations. Module second or session 2 includes investigations, counseling, psychotherapy, sex therapy, sensate focus, pharmacotherapy, coital postures, man and woman similarities and differences, what does man and woman want, and personality evaluation. Session 3 or Module 3 includes masturbation, homosexuality, oral and anal sex, and consummation, sex factors helpful in treating infer- infertility, male infertility, myth and misconception, frequently asked questions, FAQ, hypoactive sexual desires, sexual aversion disorders, male erectile disorders, impotence, and premature ejaculation, and so on. And last, sharing with you and every students who registered for fellowship, masters, and doctorate under this program has to present their thesis chapter during hands-on training program. And the various assignment we form. First assignment is consent letter. Each and every patient has to take the consent before examination. And first assignment is penile Doppler test or simple test as a stamp test with the preparation of corrugated ring of paper and that applied at the base of penis at bedtime and evaluated whether the patient having organic cause or vascular cause or psychological cause and so on. Second assignments on shockwave therapy. That is a low intensity shockwave therapy is waves are is used on extracorporeal of the penis, and after third and fourth session, and you have to observe the improvement, early morning improvement of the patient and their erectile dysfunction stages improvement. Third assignment on PRP is a platelet rich plasma, is also called a P shots. Is a There is a special kit for the PRP is used here, and blood sample of the patient around 20 to 40 units or ml is used for separation of PRP or platelet rich plasma or growth factors, and that will be injected at various sites of penile shaft. Fourth assignment on meridian stimulation, which is based on the science of acupuncture. The each and every organs is reflected on the body in the lining form is called the meridian. If you treat that lining on the body, will help to reduce the illness that is stimulated with this gadget. And fifth assignment is on vacuum erection device, how to use it, and how to apply the PV's ring to keep the erection more rigidity during intercourse. Sex assignment on: if everything is normal, male and female sexual problem, still there is infertility issue, at that time to find out the position of uterus in sonography of the female partner, and if it is a retroverted uterus, then doggy pose. If anteverted uterus, then keep the pillow below the back before intercourse to reach the sperms directly towards, or movement should be in the uterus, pass through via vaginal passage. Practical 9 assignments is various 400 MCQ are used during this evaluation of the knowledge of students. And on the basis of their psychological factors, we use psychosexual counseling. We need personality evaluation. Most of the times, the interpersonal relationship is disturbed due to the mismatching of their personality of the individual, which includes mostly powerful personality, popular personality, peaceful and perfect personality. There are various weaknesses and strength of the individual is marked here. If strength or more scoring personality is called the dominating personality or God-given personality, that is the basic nature of the person, you can't change it. The weak part of the personality, out of 4, 2 will be dominating personality and 2 will be the weaker, their score is lesser, then at that time you have to improve that. Suppose patient is a powerful and his peaceful personality is weak personality, then you can't change the powerful is the dominating personality and weak personality is peaceful, can improve into the strength by suggestion and counseling. There are various modules of counseling. Here, premarital counseling and postmarital counseling. We use the Pleasant model, P start permission, LI limited information. You have to take the permission from the client or the patient. Then limited information is provided them or guide them accordingly, and specific suggestion is given time to time, and intensive therapy advice like relaxation techniques and meditations and behavioral therapy and so on. Counseling, there are various types of counseling in which includes systematic desensitization, that is the Pleasant model, and cognitive behavior therapy, behavioral modification, CBT, PTEQ test, personality test, and emotional quotient, behavioral activation therapy, ACT, acceptance and commitment therapy, PST, problem solving therapy, and REBT is rational emotive behavior therapy, and so on. Now, 11th is the diet prescription of the assignment is very important. Most of the students complete this diet prescription assignment when they come for hands-on training program. They complete their own place, own clinic. Here, diet is prescribed according to the height, weight, BMI, and BMR is used because overweight reduces the testosterone that indicate or clinical features showing like low libido, erection problem, decreased muscle mass in obese patient, abdominal fat is more in obese, man boobs are more, constant fatigue, lack of focus and depression. Man who has normal weight, their higher testosterone, decreased body fat, strong erection, high sex drive, increased muscle mass, healthy heart, and elevated mood and confidence and mental focus. And in this assignment, we also take one part, innovative part, that is a step for good health. It is the lifestyle modification program, step for physics, for their this body physics, chest and abdomen in one line, step for stamina and BMI and BMR evaluation. BMI must be between 18 to 23. If it is more, then it's obese, about 24, 25, and so on. Maybe sometimes get 40 BMR. If you have to find out the BMR is the basal metabolic rate, where the basic calories needed for activation of daily work. If it varies from person to person, as per depend upon the height and weight, it's around 1200 to 600, 1600, and so on. This much calorie you have to provide. If he is eating excess, then you have to reduce the calories. And diet calorie wise prescription includes more proteins, less carbs, and fats. Along with this, we're sharing with myth and misconception amongst the various male and female sexual problem. We remove this during the sessions. Digital marketing is very important, and with search engine optimization, we use and we train them. And practical assignment for exercises, for pelvic floor exercises, for female, and Kegel exercises for male are advised, and various programs are conducted, and thesis is presented like 2 copies they have to bring, 1 copy they have to keep at institute for their program, and one is signed and given to back to the fellowship, masters, and doctorate students. Various books, there are 30 to 40 books. We use male and female sexual problem, every book's ideal relationship, the complete sexual well-being, education. All books are available on Amazon platform, written by my colleagues and myself, and few contribution from students. Every batch contain around 10 to 12 students for training program. This is the office where the students are these things. The WNHO Institute of Sexology course accreditations and certified sexology program is a unique program we are conducting so far in Pune. Is a unique institute. Thank you very much. We'll see you soon at the end during hands-on training program. Thank you very much.